Welcome back to my channel. In this video, we are covering some MCQs on typhoid fever, which are perfect for the pharmacy, medical, and the nursing students. Each question comes with clear explanations to help you remember the concepts better. So let's get started. First question, typhoid fever is caused by. The options are Salmonella typhi, Escherichia coli, Vibrio cholera, and Shigella dysentery. So the correct answer is Salmonella typhi. So this is the bacterium which is responsible for the typhoid fever. It is a gram-negative bacteria which is rod-shaped, which invades the intestinal mucosa and enters the bloodstream, which causes a systemic infection. It is found in the contaminated food and water, especially in the areas with poor sanitation. Second question, the most common route of transmission of typhoid fever is. Options are blood transfusion, airborne droplets, fecal-oral route or fecal-oral route or direct skin contact. So the correct answer is fecal-oral route. Why? Because typhoid spreads mainly through the fecal-oral route. This means consuming the food or water contaminated with feces from an infected person. It is why typhoid is more common in areas lacking the clean water and proper sewage disposal. Third question, which of the following is a common symptom of typhoid fever? Options are constipation, bradycardia, rash, also known as rose spots, all of the above. So the correct answer is all of the above because constipation is more common than diarrhea, especially in the adults. Relative bradycardia, which is the slow heart rate despite fever, it is a classic but uncommon finding. Rash, rose spots, these are the pink rashes on the chest or the abdomen seen in the second week of the illness. Fourth question, which antibiotic is commonly used in the treatment of typhoid fever? Options are amoxicillin, ciprofloxacin, azithromycin and metronidazole. So the correct answer is ciprofloxacin. Ciprofloxacin is a fluoroquinolone which is often used to treat typhoid. It is a first-line treatment given. However, the resistance is growing in some regions, so alternatives like azithromycin or ceftriaxone are now also recommended based on the local resistance pattern. Fifth question, a patient with typhoid fever treated with ciprofloxacin reports joint pain and swelling. So, what could be a likely ADR? Options are tendinitis, nephrotoxicity, hepatotoxicity, and myelosuppressions. So the answer is tendinitis because fluoroquinolones like ciprofloxacin are associated with tendinitis and even tendon rupture, particularly in elderly patients and those on corticosteroids. It's a serious but well documented adverse effect. Sixth question, which of the following vaccines is used for the prevention of typhoid fever? Options are BCG vaccine, TY21A oral vaccine, DPT vaccine, IPV vaccine. So the correct answer is TY21A oral vaccine. It is a live attenuated oral vaccine which is used for typhoid prevention. Another option available is VI polysaccharide injectable vaccine. Vaccination is especially important for travelers to the endemic areas. Seventh question, multi-drug resistant MDR typhoid fever is defined by resistance to option A ciprofloxacin and azithromycin, option B chloramphenicol, ampicillin and trimoxazole, option C ceftriaxone and gentamicin, option D rifampicin and isoniazid. So the correct answer is option B chloramphenicol, ampicillin and trimoxazole. Why? Because MDR typhoid is defined as a resistance to the three classic first-line drugs, the chloramphenicol, ampicillin and trimoxazole. This has led to increased use of newer antibiotics like ceftriaxone and azithromycin. Eighth question, which of the following is a serious complication of untreated typhoid fever? Options are intestinal perforation, meningitis, hepatic coma, and pancreatitis. So the correct answer is intestinal perforation. Why? Because it occurs due to the ulceration of the Peyer's patches in the ileum. This is a life-threatening complication leading to the peritonitis and sepsis if not treated surgically. Ninth question. For a patient with typhoid and renal impairment, which of the following antibiotics require dose adjustment? So the options are ceftriaxone, ciprofloxacin, chloramphenicol, and azithromycin. So the correct answer is ciprofloxacin because it is a renally excreted and must be dose adjusted in the patients with reduced kidney function. On the other hand, ceftriaxone is mostly excreted through the liver and often does not require the adjustment. 10th question. Which of the following is the most definitive method for diagnosing the typhoid fever? Options are Vidal test, stool microscopy, blood culture test, and urine analysis. So the correct answer is blood culture test. It is a gold standard, especially within the first week of the illness. It provides direct evidence of the infection by the growing Salmonella typhi from the bloodstream. So that's all for today's MCQ session on typhoid fever. We hope this helps you to prepare smarter for your exams. Don't forget to like, comment, and subscribe for more clinical pharmacy content. Hit the bell icon to get notified when we upload our new videos. Thank you for watching and stay curious, stay clinical. Thank you.